Gregory Niebel. This is Dr. Bennett, Scene 2. Mrs. Davidson. After talking to my GYN-ONC colleague and reviewing your brain biopsy, I'm sorry to inform you that you are suffering from stage 4 invasive epithelial ovarian cancer. Because this type of ovarian cancer is more rare to the brain than other types, the treatment options aren't as well defined. Typically, among patients with stage 4 without brain lesions, this would be treated with debulking the lesion followed by chemotherapy. However, because you have multiple lesions, our priority right now is to contain the swelling in your brain. Because of this, we have you on steroids to control the swelling, and we have you on anti-seizure medication. Unfortunately, at this point, we have no cure for this type and severity of the cancer that you have. There are some treatment options that I can present to you. Usually, if this were a single lesion, we would go in and try to remove the tumor, and followed by whole brain radiation. In your case, unless it's an emergency situation, we often recommend whole brain radiation to try to keep the tumor size at bay and possibly buy you some time, weeks to several months. Do keep in mind, there are no guarantees in this treatment, and there are side effects. Mrs. Davison, I can't give you any guarantees, and I never want any of my patients to lose all hope. However, I can only give you what is most typical patient scenario, which is, in your case, 3 to 4 months without any treatment. I am so sorry, Mrs. Davison. Unfortunately, the symptoms of ovarian cancer are so subtle and non-specific that it is highly unlikely that anything can be noticed until I'm sorry, Mrs. Davidson. I know this is a lot to absorb. Mrs. Davidson, I know you're upset, and it's best not to jump to any hasty decisions at this point. We can all agree that you need rest. And take some time to talk this over.